So when we start looking at the clinical implications on some of this, out of the President's Cancer Panel report said that all patients should be counseled about the psychosocial effects. Fertility counseling, as you know, ASCO now has guidelines out on this, supportive care and guidance for family members and caregivers. These are recommendations coming out of these reports that we are going to be held to. We are going to have to say, are we doing what these panels have recommended that we do? And the most recent IOM report, this came out last November, and in fact I was on Monday at a Hill briefing supported by Representative Lois Capps' office on this very document on how we're going to deliver psychosocial care to our cancer community. If you're not familiar with this report, it's potentially going to receive a great deal of traction. And basically what it says is we need to be meeting these needs across the course of care. Can't be relegated to, oh, if I have time or if they're staff. They need to be an integral part. And as you heard Kristen talk about in the COPE project, they now have some elements that they're going to be trying to put into that evaluative mechanism as a quality indicator. It's been developed by my friend and colleague Paul Jacobson at the Moffitt Cancer Center to try and ascertain are questions being asked about psychosocial functioning, emotional health, and if a problem is identified, what's happening with regard to this. Because this report says basically what needs to happen is that clinicians need to be asking about these domains of functioning. If a problem is identified, a treatment plan needs to be delivered or proposed, recommendations made, but critical to that is that bottom line. Then there has to be follow-up and reevaluation. It's not enough that the clinician said, yes, she said she was depressed, I prescribed her Prozac, end of story. If you don't know if she took the Prozac because she didn't like it, she was scared about it, she thought you were telling her she was crazy, she couldn't afford it, it didn't work, you haven't done anything for that patient. So this is in some ways that missing link. And all of this, as far as the report recommenders felt, was predicated on good patient-physician communication. That they felt was the backbone in here. And the timing of the release of that report was very felicitous because at the same time, the National Cancer Institute released its monograph on patient-centered communication and cancer care. This is another volume that I commend to you for your practice because what it lays out is what we know about effective patient-doctor communication. What are the techniques or practices that work? What are the ones that do not work? What is the best standard of quality delivery of good patient-doctor communication? The other component that's received a lot of traction in both the President's Cancer Panel report and the Institute of Medicine reports is this issue of developing and delivering a treatment summary and follow-up care plan. This is something where there's been language put into several congressional bills that are parked right now on the Hill that may be consolidated into an omnibus bill that Senator Kennedy is helping to champion, where they're going to put all of these elements together that have quality of care indicators in them. And as you heard again, Kristen McNiff talk about, is ASCO has already taken this in the mouth and run with it, which is wonderful. They have a template now that one can use for a generic treatment summary and care plan. So I'm not going to spend too much time on these slides because you've already seen them, basically the components that go in there and the care plan. The critical piece in the care plan, and this is still a work in progress, are the issues related to what are the kinds of interventions that you want to do for chronic problems or to anticipate those that may come up later, addressing the psychosocial piece in here and promoting health.